Hey everyone, welcome back to the Deep Dive. Today we're going to be tackling a topic that I think is super important.
Oh,
And
yeah.
I bet you do too.
Mm-hmm.
Patient empowerment.
Yeah.
We're going to be looking at a ton of different sources today. We've got articles, we've got blog posts, we've even got newsletter entries from this really cool newsletter called Chronically.
Cool.
It's all about patient empowerment.
Awesome.
And we've got our expert here to help us kind of break it all down and make sense of it.
Happy to be here.
But we're also going to be looking at the story of this guy, Roy Sternin.
Oh, yeah. Roy is great.
Have you heard of him?
Oh, yeah. He's amazing. He's a real pioneer, I think, in patient advocacy.
Yeah, he's doing some really cool stuff, and his story is really what makes this whole deep dive so fascinating. Because he's not just talking the talk; he's really walked the walk.
Right.
He was actually bedridden for 10 years.
Wow.
Because of a misdiagnosis.
It's hard to even imagine.
It's crazy, and he eventually ended up self-diagnosing
Really?
with POTS.
Wow.
Postural orthostatic tachycardia syndrome.
Yeah, I've heard
Yeah.
it can be really debilitating.
Yeah. And so now he's like using that whole experience to try to like push for change in healthcare, and all from the patient's perspective.
That's so important, I think.
Yeah, so 10 years bedridden. I mean, that just blows my mind.
Yeah.
And what I love about Roy is he doesn't just want patients to have a seat at the table. He wants them to like lead the conversation. He has this idea that the next speaker at any healthcare conference
Okay.
should be a patient.
Interesting.
Like that's who should be up there talking. And he says that without that like authority of lived experience,
Yeah.
so many healthcare decisions are being made in this like vacuum,
Right.
and they're missing the mark.
Yeah, they're missing the human element, I think.
Yeah. What do you think about that?
I mean, I think he's absolutely right. You know, we've got all these CEOs and doctors and researchers,
Yeah.
all these people who are incredibly knowledgeable.
Oh yeah, super smart.
But how many of them have actually like been in the patient's shoes?
Right? Have they actually lived it?
Yeah. And patients bring that raw human element that you can't get from data and research.
Yeah, it's like the difference between reading a textbook and like hearing someone's war stories.
Exactly.
It's just a totally different impact.
You feel it on a visceral level.
Yeah, and you can see that in Roy's own journey.
Mm-hmm.
You know, he was misdiagnosed for years.
Right.
He had to fight to become his own advocate, and then he finally figured it out.
Wow.
And not only that, he's not just surviving, he's thriving.
Mm-hmm.
And that's like true resilience.
Absolutely.
So what's the thing that stands out to you in his story? What really like jumps out at you?
I think what really strikes me is how Roy highlights the need for a fundamental shift in the whole doctor-patient dynamic.
Okay.
He doesn't want patients to be seen as like passive clients.
Yeah.
He wants them to be active participants,
Okay.
like co-piloting their healthcare journey.
Oh, I love that analogy.
Yeah.
Co-piloting. That's a game changer.
Mm-hmm.
And it makes me think about something else that Roy talks about, the hidden costs of chronic illness.
Right.
You know, it's not just the physical stuff. There's this huge mental and emotional toll
Oh, yeah, absolutely.
that often gets like swept under the rug.
It's often overlooked, yeah.
Yeah, and I think ignoring that piece can have some serious consequences.
Oh, for sure.
Roy talks about how like the need to prove his worth,
Okay.
to show that his illness didn't define him,
Right.
actually led him to push himself too hard.
Oh, wow.
And then he would have these relapses.
Yeah, that's a cycle that a lot of people with chronic illnesses get trapped in.
Yeah, it's like this pressure to appear normal,
Right.
even when you're fighting this internal battle
All the time. Yeah.
every single day.
Yeah. And that pressure can be incredibly isolating.
Yeah.
Roy describes feeling like a solitary island, you know, like cut off from the world.
Wow.
And it just underscores how important community support is
Yeah.
for anyone dealing with a chronic illness.
It's about knowing that you're not alone in this fight.
Community is everything,
Absolutely.
especially when you're facing a challenge like chronic illness.
For sure.
But Roy doesn't just like call out the problems.
Right.
He actually has some really cool ideas
Right.
for how to empower patients.
I'd love to hear about that.
Okay, so he envisions these things called patient schools.
Patient schools.
Yeah, and he talks about shared decision-making
Okay.
with doctors and readily available medical information. And get this, he even argues that we should value a patient's time as
Okay.
much as a doctor's time,
It's about time.
which, let's be real, is long overdue.
Yeah.
What makes these ideas so revolutionary in your mind?
I think what's so fascinating is how these ideas connect to this this whole rise of the e-patient.
The e-patient.
Yeah, someone who's actively using technology and information
Okay.
to manage their own health.
Mm-hmm.
They're not just blindly following doctors' orders anymore.
Right.
They're becoming informed advocates for themselves. Yeah, it's like patients are finally stepping into their power.
Exactly.
And Roy paints this really vivid picture of what's possible.
Okay.
He talks about this like ideal patient journey
Mm-hmm.
where you have a case manager guiding you through the whole process,
That would be amazing.
and community-based rehab programs,
Right.
and medical professionals who are like prioritizing empathy
Right.
and human connection.
That's what it's all about.
It's hopeful,
Oh.
but is it realistic?
Well, I think it's about shifting the entire healthcare paradigm.
Okay.
And one of the most radical ideas that Roy proposes is recognizing the expertise
Oh,
of patients themselves.
Huh.
He says that outright patients are experts too.
Whoa, hold on. That's a bold statement.
It is.
What does he mean by that?
Well, think about it. Patients are the ones living with these conditions every single day.
Right.
They know firsthand what works, what doesn't work, and where the system is failing them.
Yeah.
Roy suggests creating these things called patients in residence.
Patients in residence.
Yeah, within healthcare organizations.
No, no.
So these individuals, drawing from their lived experience,
Okay.
would provide feedback and guidance.
Interesting.
They would be like consultants almost.
So they would be working within like a hospital or a clinic.
Exactly.
That's really cool.
Yeah.
And Roy's already putting this into practice, right?
He is.
He's working to teach healthcare professionals
Mm.
how to communicate better with patients.
Yeah.
He stresses that the foundation of good care is human connection and understanding.
I love that.
Yeah.
It's not just about treating diseases. It's
Yeah.
about caring for human beings. And
Yeah.
that care has to be rooted in empathy, respect, and a genuine desire to understand the patient's perspective.
I think that's a great place to
Yeah.
pause for now, and we'll come back and
Yeah.
dig into some more of these ideas
Sounds good.
in part 2.
Looking forward to it. And, you know, it's really cool how he actually goes beyond just the big picture stuff.
Yeah.
He gives some really practical advice for how to navigate the healthcare system
Okay.
as a patient.
So it's one thing to talk about systemic change,
Right.
but it's another thing to give people tools that they can use right now in their everyday lives.
Exactly.
What kind of advice does he give?
Well, one thing he emphasizes is the importance of keeping a detailed health journal.
Okay, so that's something I've always struggled with.
Yeah.
Because it feels like one more thing to add to my to-do list
Right.
when I'm already feeling overwhelmed.
Yeah.
Why does he think it's so important?
Well, he makes this really good point. He says, when you're dealing with a chronic illness,
Okay.
especially one that's difficult to diagnose, you become your own best advocate.
Okay.
And a health journal is like your evidence file.
Oh, that's a good way to put it.
Yeah.
So you're tracking your symptoms, how you're feeling,
Exactly.
any treatments you've tried.
Yeah. All of it.
Okay. And then when you go to the doctor, you've got this data
Right.
to back up what you're saying.
Yeah. It's not just, oh, I've been feeling tired lately. It's
Right.
like, look, I've been tracking my energy levels for the past 3 months.
Right.
And this is the pattern I'm seeing.
It takes the guesswork out of it
Exactly.
for both of you.
For both of you. Yeah.
It turns you into a data detective.
That's a good way to put it.
I like that.
He also talks about being prepared for doctor's appointments.
Okay.
He says, don't just show up and hope for the best.
Oh, I've definitely been guilty of that.
Yeah.
What does he suggest?
He says, make a list of questions beforehand.
Okay.
Even practice explaining your symptoms
Okay.
clearly and concisely.
So it's like having a game plan
Exactly.
so you don't get flustered in the moment.
Right, because you get in there and you're like, oh my gosh, what was I going to say?
Yeah, deer in the headlights.
Yeah, exactly. And he also stresses the importance of not being afraid to ask for clarification.
Oh, yeah.
If you don't understand something.
We're not all walking medical dictionaries.
Right. He says doctors use medical jargon all the time without realizing it, and it's totally okay to be like, wait, can you explain that?
Please.
In simpler terms? Yeah, exactly.
It's about feeling empowered
Yeah.
to advocate for your own understanding.
Absolutely.
Because I think a lot of people, especially when they're already feeling vulnerable,
Right.
they don't want to speak up or question the doctor.
It can be intimidating. Yeah.
It can be.
He also talks about the importance of finding a doctor who's a good fit for you.
Okay.
Someone who really listens to you,
Yeah.
respects your concerns, and is willing to partner with you in your care.
That's huge.
It is. It's about feeling like you have an ally.
Yeah, you're on the same team.
Exactly.
I remember this one time I went to this doctor and
Oh, that reminds me of something Roy talks about, the power of community.
Okay, yeah, we've touched on community before,
We have.
but I want to dig into that a little bit more.
Yeah.
What role does community play in all of this?
Well, Roy describes feeling like a solitary island when he was first diagnosed. Like he was the only one going through this.
But then he discovered these online support groups and patient communities,
Okay.
and he realized he wasn't alone.
So it's like those pulsating rings of light
Yeah,
that we talked about, connecting those islands.
exactly, creating a sense of solidarity.
Okay, but what's so powerful about these communities?
Well, for one thing, they provide a space to share experiences,
Okay.
advice, support.
Mm-hmm.
You can connect with people who truly get it,
Yeah.
who can offer tips, encouragement, and just listen without judgment.
That's so important.
It is.
Especially when you're dealing with all the emotional stuff.
The ups and downs, yeah,
Yeah, sometimes you just need to vent
absolutely.
and have someone who understands.
Yeah, and these communities can also be a great source of practical information.
Okay.
You can learn about new treatments,
Mm-hmm.
find doctors who specialize in your condition,
Okay.
get advice on navigating the healthcare system.
It's like crowdsourcing your healthcare.
Yeah, that's a great way to put it.
I like that. And I love how Roy stresses that community can also be a source of strength
Okay.
and empowerment.
How so?
When you see other people thriving despite their challenges,
Yeah.
it can give you hope and inspire you to keep fighting.
Right.
He talks about how seeing other people advocate for themselves gave him the courage to do the same.
So it's not just about getting information and support.
Right.
It's about feeling empowered.
Exactly. It's about realizing you're not just a patient. You're part of a movement.
A movement for change,
Yes.
for better care,
Yeah.
for a healthcare system that actually puts patients at the center.
Exactly.
And I think that's what's so inspiring about Roy's work.
Mm-hmm.
He doesn't just want to improve healthcare for himself.
Right.
He wants to create a better future for all patients.
That's the goal.
And he's not afraid to tackle some really tough topics.
Yeah, like what?
Well, for example, he talks a lot about bias and discrimination
Okay.
in healthcare.
That's important.
Yeah, and how that impacts certain groups of people.
Right.
Women and people with disabilities.
These are huge issues. We can't talk about patient empowerment without talking about these systemic inequities.
Absolutely not.
What kind of examples does he give?
Well, he points out that women often face longer diagnosis times
Oh, wow.
for certain conditions.
Really?
Yeah, they have their pain dismissed as hormonal,
Oh, my gosh.
and they're less likely to receive life-saving interventions for things like heart attacks, even when presenting with classic symptoms.
So it's like their experience and their pain are being invalidated
Yes,
because of their gender.
exactly. And he also talks about how female healthcare professionals
Okay.
often face microaggressions, have their expertise questioned,
Oh, wow.
and struggle to advance in their careers.
It's like this double whammy of bias,
Yeah.
both as patients and as providers.
Right.
We need to do a lot better
We do.
at recognizing and addressing these gender disparities
Absolutely.
in healthcare. And he also doesn't shy away from talking about the challenges faced by people with disabilities.
Okay.
He points out that people with invisible disabilities often face disbelief and skepticism,
Right.
have their symptoms dismissed as all in their head,
Okay.
and are denied accommodations that would allow them to fully participate in society.
So it's like their lived experience is constantly being questioned
Yes.
and undermined.
And that can have a huge impact on their mental and emotional well-being.
Absolutely.
Not to mention their access to quality health care.
Yeah.
He's challenging us to examine our own ableist assumptions,
Okay.
to listen to and believe the experiences of people with disabilities,
Mm-hmm.
and to advocate for a more inclusive and accessible healthcare system.
It's about recognizing that disability is not a deficit.
Right.
It's a natural part of human diversity.
Exactly.
And we need to create a world where everyone, regardless of their abilities,
Mm-hmm.
can access the care they need
Yeah.
and live full and meaningful lives.
And Roy doesn't just talk about these issues.
Right.
He's actually working to address them.
Okay. How so?
He's using his platform to amplify the voices of marginalized patients.
Okay.
He's educating healthcare providers about bias and discrimination. And he's advocating for policies that promote equity and inclusion in healthcare.
He's a true champion for social justice.
He is.
It's so inspiring to see someone who's been through so much
Wow.
turn his pain into purpose
Yeah.
and dedicate his life to helping others.
And one of the things that really struck me about Roy's work
Yeah.
is his focus on the mental health impact
Okay.
of chronic illness.
Yeah.
He doesn't shy away from talking about his own struggles with depression, anxiety, trauma.
And I think that's so powerful.
It
Because it
is.
gives other people permission
Yes.
to acknowledge their own
It's
struggles
to not feel alone.
and to seek support
Yes.
without shame.
He's helping to break down the stigma
Yeah.
surrounding mental health.
Especially in the chronic illness community. Because there is this kind of like,
There's this pressure.
yeah, this expectation to be positive all the time.
Right. And never complain.
And he's saying it's okay to not be okay.
Exactly.
And that acknowledging your struggles is actually a sign of strength,
Yes.
not weakness.
It's a sign of self-awareness.
Yeah.
And it's the first step towards healing.
So he's promoting a more compassionate and understanding approach to chronic illness,
Yes.
one that recognizes the full spectrum of human experience,
The good and the bad.
the good and the bad.
Yeah.
And he offers some really practical advice
Okay.
for managing the mental and emotional challenges
Like what?
of chronic illness.
Yeah.
He talks about the importance of self-care,
Okay.
finding healthy coping mechanisms, and building a strong support system.
Those are all essential.
Yeah, it's about recognizing that taking care of your mental health
Yes.
is just as important as taking care of your physical health,
Absolutely.
and that it's okay to ask for help
Yes.
when you need it.
And he emphasizes that mental health care should be integrated into every aspect of chronic illness care.
So it's not just this separate thing.
Right. It's not an afterthought.
Right, it needs to be part of the whole picture.
Exactly.
Yeah.
He advocates for more mental health screenings in primary care settings,
Okay.
more access to therapists and counselors who specialize in chronic illness, and more support groups and online communities where patients can connect with others
Yeah.
who understand what they're going through.
It's about treating the whole person,
Yes.
not just the disease.
Exactly. And it's about recognizing that mental health is not a separate issue.
Right.
It's intricately connected to our physical health and well-being.
Yeah.
They're interconnected.
And I love how Roy emphasizes the importance of finding joy and purpose
Yeah.
in life, even in the face of chronic illness.
Mm-hmm.
He doesn't want people to just survive.
Right.
He wants them to thrive.
To flourish.
To flourish, yeah.
To live their best life.
And he wants them to find meaning and fulfillment, to connect with their passions,
Yeah.
and to make a positive impact on the world.
He's a shining example of that himself.
He is.
Despite all the challenges he's faced, he radiates positivity and purpose.
It's true.
He's found a way to turn his pain into power, his struggle into strength,
Yeah.
and his experience into expertise.
And he's using that expertise to empower others,
Yes.
to advocate for a better future for all patients, and to create a world where everyone has the opportunity not just to survive, but to thrive.
He's a true inspiration.
He is.
And his work is a reminder that even in the face of adversity,
Yeah.
we can find hope, we can make a difference, and we can create a better world for ourselves and for others.
You know, it's amazing how Roy can connect his own story
Yeah.
with this like bigger vision for change.
Right.
He doesn't just talk about the problems. He actually offers solutions.
He does. He's a problem solver.
Yeah, it's like he's handing us this roadmap
Right.
to a better future for healthcare.
Yeah. And one of the key things he talks about is this need for like a paradigm shift in how we see patients. Instead of seeing them as these passive recipients of care, we need to start seeing them as active partners in their health journey.
It's about shifting that power dynamic,
Yeah.
recognizing that patients have a lot of knowledge
Mm-hmm.
and insight to offer.
They do.
I mean, who knows more about living with diabetes?
Right.
The doctor who studied it in a textbook,
Right.
or the person who's managing it every day?
Exactly. And Roy takes that idea of partnership even further.
Okay.
He sees patients being involved not just in their own care,
Okay.
but also in research,
Okay.
policy decisions, even the design of new technologies.
That's awesome.
Yeah.
Imagine patients being brought into the lab,
Yeah.
working alongside scientists to develop new treatments.
Right.
Or sitting at the table with policymakers
Mm-hmm.
to shape legislation.
It's about making sure that the patient voice is heard at every level of the healthcare system.
And Roy also talks about the need for a more personalized approach
Right.
to healthcare,
Yeah.
recognizing that each patient is unique
Of course.
and has their own needs and preferences.
Not one size fits all.
Exactly. It's about tailoring treatment plans to the individual, taking into account their lifestyle, their values,
Right.
their goals.
Your preferences.
Yeah. And I remember reading about his concept of shared decision-making,
Oh, yeah.
where doctors and patients work together to come up with a care plan
Yeah.
that really aligns with the patient's priorities.
It's a collaborative approach.
Yeah.
recognizing that the patient is the ultimate expert on their own body and their own life.
And Roy says that this whole collaboration thing really depends on clear communication,
Oh, for sure.
making sure patients understand their diagnosis, their treatment options,
Yeah.
the potential risks and benefits.
And he even talks about using technology to enhance communication. Things like online patient portals, secure messaging, telehealth platforms.
Technology can be such a game changer
It can.
for connecting patients and providers
Mm-hmm.
and for giving patients more control over their information.
Absolutely.
It's like we're finally moving away from that paternalistic model
Yeah.
where the doctor knows best
Right.
and the patient just follows orders.
It's about empowering patients to ask questions,
Yeah.
to advocate for their needs, to make informed decisions about their health.
And Roy points out that this whole shift towards patient empowerment,
Yeah.
it's not just about individual responsibility.
Right.
It's about creating a healthcare system
Yeah.
that actually supports and enables patient engagement.
It's about creating the structures, the resources, the culture that truly puts patients at the center.
It's a big task.
It is.
But Roy seems to believe it's possible.
He does, and his belief is contagious.
It is.
He reminds us that change is always possible, even in a system as complex as healthcare. But it requires all of us, patients, providers, policymakers, communities.
Everyone working together.
Everyone working together, yeah.
So as we wrap up this deep dive into patient empowerment,
Yeah.
I'm feeling really inspired,
That's great.
but also a little overwhelmed.
Yeah.
Like, where do we even begin
yeah.
to tackle this huge issue?
That's a great question. And I think Roy gives us some really concrete answers.
Okay.
If you're a patient, he encourages you to speak up.
Okay.
Ask questions, share your experiences, and advocate for your needs.
Don't be afraid to be your own best advocate.
Exactly. And if you're a healthcare provider, he challenges you to really listen to your patients,
Yeah.
to see them as partners in care, and to create a space where they feel safe, respected, and empowered.
It's about shifting that mindset
Yeah.
from fixing patients to empowering them.
And if you're a policymaker, he urges you to advocate for policies that promote patient-centered care,
Okay.
expand access to health care, and support the mental and emotional well-being of all patients.
Yeah. Because at the end of the day, patient empowerment isn't just about improving healthcare.
Right.
It's about creating a more just compassionate and equitable society for everyone.
It's about recognizing that healthcare is a human right,
Yeah.
not a privilege,
Everyone deserves access.
to high-quality, patient-centered care.
And it's about empowering patients not just to survive,
Yeah.
but to thrive,
To flourish.
to flourish,
Yeah.
to live full and meaningful lives,
Regardless of their health challenge.
regardless of their health challenges.
So what's the one thing you hope our listener takes away from this deep dive?
I hope they feel empowered to join this movement for change,
Okay.
whether it's by advocating for their own needs, supporting organizations that are working to improve healthcare,
Yeah.
or simply by listening to and believing the experiences of patients.
Every voice matters.
Every voice matters.
Every action counts.
Every action counts.
This has been such an insightful conversation.
It has.
I can't thank you enough for sharing your expertise.
My pleasure. And to our listeners, thanks for joining us on this deep dive.
Yeah, thanks for listening.
We'll be back next time with another fascinating topic.
Can't wait.
Until then, stay curious, stay engaged, and stay empowered.